Now, the declaration of year 2020 as the International Year of the Nurse and the Midwife by the World Health Organization could have come at a better time, could not have come at a better time rather, because they risk their lives daily while rendering life-saving services to individuals. It has provided the world an opportunity to celebrate and honor nurses and other healthcare workers for their courageous work, especially in the face of coronavirus pandemic. As health workers at the front of the world's struggle to tackle an invisible enemy, nurses continue to pay the price irrespective of the cost to ensure the public health crisis is tamed. Joining me via Skype is Director of Family Health and Lead Nurse at Africa International Foundation, Julie Mogbo. Good morning, Julie. Thank you for joining us on TVC Breakfast.
Good morning, Veronica.
I must say thank you for nursing the world to health. That's the focus this year. This year's theme is all about. But talk to us about the voices from nurses nursing the world to health. Is the world beginning to recognize this voice, especially at a time such as this?
Thank you so much, Veronica. Talking about the theme of the year and of Nurses Day, we have had situations in the past where once upon a time, nurses were only meant to be seen and not heard. They weren't considered as critical part of the healthcare team that could bring in critical thinking or clinical judgment when caring for patients or discussing or having a discussion around healthcare delivery. It was a difficult thing in the past, and some facilities still struggle because certain decisions are taken that has to do with health, and there's low representation of the nurses or the nursing profession, and they form a critical role in the healthcare team. So talking about the voices, little wonder they had to do that, because it has been discovered even in other clients, the contributions, the immense contributions that nurses bring to healthcare delivery. And it's important that their roles are looked into, their voices are heard. If we have to establish a healthcare system that services all and brings majority. So it has not been like that in the past, but this year, when it started, nurses were excited that after 200 years, this is the first time that a whole year is dedicated to a profession, and a very important one at that. So the excitement was there at the beginning of the year. But when we had the experience of COVID-19 and the world thrown into some kind of pandemonium, it somehow dampened that excitement. But thankfully, for those that are optimistic, we started talking to ourselves and saying that this is the best time to actually let our voices out. This is the best time to push ourselves forward. So rather than be demotivated, let's use this COVID-19 pandemic as a stepping stone, and then do what we ought to do. So right now, thankfully, we are listening to nurses. We are inviting them to discussions table. We are beginning to see the need to change policies and all that. It's something great, it's something good, and it's something that would serve the good of the larger populace in the nearest future.
So indeed, you are confident and hopeful that now that the world is recognizing the voices of nurses, that there will be a lot of change post-COVID-19.
Yes, and I really expect so, especially in Nigeria. We have seen the contributions that nurses bring, and even though I still see the underutilization of those skills, because at this time I expect that there would have been a major call, because we still have so many nurses there who aren't doing anything. So what they are doing is taking to social media, putting out information out there, creating groups to help people, designing interventions to help different cohorts, those that have different needs. And the needs are almost overwhelming. We need the support to be able to reach out to more people. Look at the situation we are currently facing. We are now in the community phase. The spread is in the community now, and they have this. There's a need to now start activating community-based intervention programs to be able to fight the pandemic. If from the start we had recognized the critical role that nurses and midwives play, they would have been activated from the start. And just perhaps, just maybe, we may not be facing what we are currently facing. So it's a good thing that is happening currently, and I do hope we learn lessons from it. And we're seeing the bright cloud, we're seeing the light, and we're optimistic that post-COVID-19, that things are going to change. There's going to be increased employment of nurses. They're going to be expanding the decision-making table to include nurses. They're going to be restructuring of the healthcare system. There's going to be recognition of nurses and the roles, more recognition of nurses and the roles that they play in the healthcare industry.
All right, so Julie Mogbo, thank you so much for speaking with us.